Hey guys, Dr. Ben here, Functional Medicine Centers. Let's talk about the thyroid today. So many people are dealing with thyroid issues. So many people are wondering if they're dealing with thyroid issues. They've looked online, they've listened to podcasts, listened to different seminars and speakers and all types of different things. And they go, it's gotta be your thyroid, it's gotta be your thyroid, it's gotta be your thyroid. Well, guess what? It doesn't always have to be your thyroid, but if it is your thyroid, you gotta take care of it. So that's what we're gonna talk about today. How do you know if your thyroid is off? What can you tell from home? What can you tell from tests? And then what you can do about it. And it's rampant. So many people are dealing with thyroid issues, and yet not many people know what to truly do. So welcome, love having you guys on here. Go ahead and pop down below where you're watching from. Let me know if you've got a thyroid issue, if you've been tested for Hashimoto's, if you know what your TSH is. Any information, pop down below, and we'll discuss that as we go along here as well. Also, where are you guys watching from? Hey, Monica, great to see you. And pop down below where you're watching from, and then like or follow our page if you haven't, and share this with anybody that you know that is dealing with thyroid issues. Absolutely crucial to get this figured out. Hey there, JM in Louisiana. All right, so do you have low thyroid? And that's what we've got to figure out. So here's some of the symptoms that people will be having. If you're having fatigue, if you're cold all the time, if you're constipated. So remember, the thyroid is like turning up the thermostat. So if I went over, if it was cold outside, if I went over, turned up the thermostat and went up to 75, then the thermostat would make the room here 75 degrees. If I turned it down, it would turn it off and it would cool off in there. So the thyroid, that's job is to turn up or down our thermostat. So a lot of these things, cold easily, fatigued, can't lose weight, a lot of these symptoms are going to be, kind of think about the low thermostat. You know, the thermostat is turned down too low and you're just not going to have that get up and go, versus if somebody's really high thyroid, they're going to be set at 82 and just really overwhelmed, overstimulated that way. So most people, over 95% of people, that if they have a thyroid issue, it's low thyroid. So most of you out there listening are going to be hypothyroid if you do have a thyroid issue. Some people are hyper, but most people are hypo. So we're going to get into why that is, but here's again the symptoms. There's over 20 million people in this country with low thyroid. Levothyroxine, it's T4. Give me a thumbs up if anybody out there is actually taking levothyroxine, or for that matter, any thyroid thing. And hey, Mary, you got Hashis and low thyroid. Yep, those go hand in hand. Give me a thumbs up if anyone is actually taking thyroid medication. And there's over 20 million prescriptions out there a year that are filled for thyroid medication. It's the number one best-selling drug in this country. So if you're taking it, you're one of the number ones. So hey, Julie, good to see you. And Mary, my husband, was diagnosed with prostate cancer. His thyroid is low as well. Yeah, you gotta figure out why it's low, which I'm gonna talk about here. So again, think about this: fatigue, cold easily, constipation, so just not moving things through like it's supposed to, dry skin, so excessively dry skin, just that you look at it and you're like, this is just not right. Hey Julie, great, glad your dose is cut in half now. Weight gain, so easier to gain weight. Puffy face, some people are gonna get puffy face from having low thyroid. Hoarseness because of that thyroid pushing on there. And yep, Mary, you're taking the natural NP thyroid. Some people, here's the interesting one, their cholesterol will actually go up. So if you have high cholesterol, it might be a thyroid issue. Muscle aches, pains, joint pain, things like that. There's somebody on Synthroid. Increased menstrual cycles, increased bleeding, things like that. Nodules, yeah, we got some nodules on that thyroid. Also, thinning hair. So I have women come in all the time and they're like, holy cow, or their husband pulling hair out of the out of the drain. Patricia was on Synthroid. Once it was taken off, once my levels were normal. My cholesterol levels are way high too. Leanne, yeah, the cholesterol, that's a really good indicator. Like I'll see people, they're like, oh, I'm totally going off my thyroid medication, and their cholesterol hit like 350. It'll go through the roof. And we're like, holy cow, what happened? Like, oh, you went off your thyroid medication just abruptly and didn't fix anything. And so that cholesterol went through the roof. Low heart rate. So some people, low heart rate, low blood pressure, you stand up, get dizzy easily, hair thinning, depression. So more of that lower motivation, depression, some of those things. We've got decreased memory. So, well, you know, it could be a lot of different things, but decreased memory function can be part of that. And even just swollen thyroid. So some people will get a full-on goiter, but other people can just feel it. It'll kind of be pushing on you. And these are some of the things that you can test for at home. One, you want to sit there like this, and right in this area, you want to palpate around that thyroid. And it should just feel like, okay, there's a little bit of something over your goozle, over your windpipe, and if that's okay, you know, then it should be fine there. But palpate it, and if there's, sometimes we'll feel little nodules in there. Sometimes one side will be puffier, bigger in there than the other side. If you're swallowing and it feels like there's something in your throat or some pressure, that could be the thyroid actually pushing back into the throat that way. So those are some of the basic things. One, the symptoms. Two, what you can actually feel yourself are going to be part of this as well. Hyperthyroid, not very many of you, but hyperthyroid is going to be opposite. So it's going to be through the roof. So you want to palpate. Then write this down. I'm going to give you some really important tips for testing your thyroid. So if you're going to get your blood work done, you've got to demand from whoever is running that blood work that they run these numbers. It's absolutely crucial. So this is one of the most important parts, is to run the numbers in the blood work. And there's some really specific things we need to know. If you have not run your thyroid antibodies, you have to do that. It's thyroid peroxidase, or just write down TPO, anti-TPO as in antibodies, and anti-TG or thyroglobulin. So there's two types of Hashimoto's. Some of you saying that you have Hashimoto's, I almost guarantee you don't know which one that it is. If you do know which one is positive, let me know, pop those down below. But otherwise, anti-TPO, attacking the thyroid. Anti-thyroglobulin is the bus. Thyroglobulin is the bus that's transporting the thyroid hormones around the body. If you have anti-TG, you're attacking the bus. You could take all the thyroid in the world and you are not going to get there. Hey Greg, we'll get you the number for the Phoenix office here in just a second. So if you've got the thyroglobulin, if you've got that bus transporting hormones around the body and you take some thyroid hormone, it's going to get there. But if you take thyroid hormone and your bus is broken down, my kids went to youth camp a couple weeks ago, they were all out there ready at 7:15, let's go. And if the bus was broken down, if the tire was down, they would not be able to have gotten to camp. And that's what happens with the other part of the Hashimoto. So yes, it's attacking the thyroid, but it can also attack the transportation system. So you've got to test both of those thyroid antibodies. So write that down, TPO and thyroglobulin. Has anyone had those tested, and which one are you dealing with? Go ahead and pop that down below. Number two, you've got to test your TSH, thyroid stimulating hormone. Is TSH a thyroid hormone? Say no, it's not. Mary, you got low antibodies. So as in you don't have Hashimoto's or you do have Hashimoto's. I just did both. Leanne, what did you find? So we've got thyroid stimulating hormone, comes out of the pituitary and tells the thyroid what to do. And so the TSH is not a thyroid hormone. So they're just making a big assumption that if TSH is off or good, you're not having a thyroid problem, or you are having a thyroid problem. But all you're doing is going off of what the pituitary is telling us, not off of what it's actually doing. Hey Cynthia, good to see you there in Texas. So the pituitary, TSH, tells the thyroid what to do. So in theory, if the horse is running too slow, we are going to need to whip it to go faster. TSH will go up high. If we are running too fast, if the horse is running too fast, TSH will go low. So in theory, we can look at TSH and assume what the thyroid's doing, but that's not the whole story. So Diana, there you are. You have the high thyroglobulin antibodies. So again, the thyroglobulin and Leanne, yeah, both of those are negative. Less than 1, and antibodies was at 10. So unless it's the different lab range, those should be fine, Leanne. But Diane has the thyroglobulin antibodies, which means her body is going to have a harder time transporting thyroid around the body. So Diane, you've got to make sure that your body and your thyroid hormones and everything else is working as optimal as possible. So you've got to look for your thyroid antibodies, TPO and thyroglobulin. You've got to look at your TSH. Doesn't tell the whole story, but it at least gives us part of the puzzle. And then you've got to look at your free T3 and T4 and your total T3 and T4. So all 4 of the T3, T4 hormones. And usually if they're low, the TSH will be high, and that's a low thyroid. If they're higher, the TSH will be low, and that's more of a hyperthyroid. So that's good in theory, but that's not the whole story either. What we see a lot of times is T4 is high and T3 is low. So levothyroxine, Synthroid are T4. T4 has to be converted into T3. T3 is the active usable form that's going to go to the cells and do what it needs to do. So T4 converts over to T3, and if it is not converting, we're not going to have that good usable form. So you could take all the levothyroxine in the world, but you're not going to get it over. You've got this beaver dam built up, and you're blocking that good active T3 from developing there. Where does that conversion take place? 60% in the liver, 20% in the gut. So if somebody is under converting, we've got to figure out why. So we go through the liver, we go through the gut, we do all of these different things to make sure that that person is going to convert as well as they should. Otherwise, there's no amount of thyroid stimulation, thyroid hormone, anything that's going to fix that. So we have to figure out Hashimoto's. We have to figure out, are you converting? Does supplementing iodine help? Val, it depends on what you have going on. If it's Hashimoto's, probably not. If it's under conversion, probably not. If it's just a straight up low thyroid, which is the next one we're going to talk about, low thyroid, where it's just low thyroid hormone, TSH is high, no Hashimoto's, and T3 and T4 are just low, then you know what? It could be just a low thyroid state, and iodine could be helpful with that. We don't see that often, but that could be part of the problem. So we've got Hashimoto's you got to figure out. We've got conversion issues that you've got to figure out, and then we've actually got low pituitary. What about Cytomel? What does that help with? Diana, so Cytomel, remember, T4 converts into T3. Levothyroxine is T4, Cytomel is T3. So when the doctor looks at the blood work and goes, oh, you have low T3, but you have plenty of T4, it must be because you just don't have enough T3. So let's give you Cytomel, which they say you're not supposed to be on very long. And then both T3 and T4 are up. But instead, you need to be going back and saying, why are we not converting over to T3? Why is that blocked? And that's the liver and that gut. So we've got to make sure that that one is converting like it should. Diana Armour is going to be T3 and T4. So TSH was 2.0, T4 7.5, T3 3.5. Yeah, Leanne, you know what? You might be one of those people that it's probably not your thyroid. And I've done videos on this before. If you don't have Hashimoto's markers, if your TSH is good, if your T3 and T4 are good, and you have these symptoms, it may be other systems are out of balance. And so I do a video once a month or so on here, and I say it's probably not your thyroid, and there's other things that are going to be causing similar symptoms. So run those antibodies, run your TSH, run your 4 T3 and T4s. Then you want to look at your here, let's get technical for a minute. TSH, if your TSH is low, that usually means that you have too much thyroid. But if your TSH is low and your T3 and T4 are low, that usually means, remember, pituitary kicks out TSH, and it's a hypopituitary not whipping the horse to go fast enough. So the horse is going slow and it needs to go faster, but the jockey's looking off over here, and then the horse wanders off into the field and doesn't even finish the race. Why would that happen? Well, the pituitary also tells the adrenals what to do and the female and male hormonal system what to do. So if somebody is adrenally insufficient, adrenally fatigued, they are not going to be getting that communication to their thyroid. So here you go, thyroid complex, lot going on. It could be your thyroid, it could not be your thyroid, but those symptoms, that fatigue, cold, constipation, can't lose weight, hair falling out, depression, crying at commercials, all these puffiness, hoarseness, all these different things could be thyroid. Then you got to palpate, you got to feel, are you choking, are you having pressure when you swallow, some of those things. And then you got to run the blood work, you got to run that TSH, run those antibodies, run that T3, T4, know the ins and outs of what's actually going on. Otherwise, you're just chasing the tail and you'll never get to where you need to be in this process. So if you got any other questions, guys, go ahead and pop those down below. You had some great input. I'll run back and see which ones I did not get to answer. So keep your heads up and I will be answering some of these questions as well. Remember, if you're having thyroid issues and you just haven't been able to figure it out, if you're in the Phoenix area, Fort Collins in Colorado, if you're in the Nashville area, come see us. We can help you with this. This is what we work with patients all the time. And if you're not in those areas, reach out to any of the offices and we can work with you remotely as well. So great having you guys on. Love all the feedback. Love you guys just wanting to take massive action and get your health back. So stay strong, make it a great day, and we'll talk to you guys soon.